From the Kyle Chevrolet Studios in West Des Moines, welcome to Iowa Live. I am Lou, and we are always excited to check in with Dr. Josiah Fitzsimmons from VERO Neuropathy to find out what he can do for your neuropathy pain. But first and foremost, Dr. J, how are you doing today?
Lou, I'm doing fantastic. Thank you.
Great. Now, we've talked about neuropathy here for a long time here. We talked about what peripheral neuropathy is, but tell everybody how this condition can really affect somebody.
Absolutely. Neuropathy is really a challenging condition that can really devastate a patient's life. Typically, it starts off as just a minor annoyance, pain, tingling in the hands, legs, or feet, maybe some numbness, electric-like, or even muscle weakness. People don't think it's a big deal.
Yeah, and this sounds incredibly scary, but this could get worse, couldn't it?
Absolutely. That's the problem, is it starts off as a minor annoyance. People think, oh, no big deal. I can live with this. I can keep progressing, and I can do my life and just deal with it. But the symptoms just keep getting worse. That's the number one thing I tell people. Neuropathy is a progressive degenerative condition. It's just going to keep getting worse and worse and worse forever unless something is done about it. And that's why people end up in walkers and wheelchairs, which we never want to see.
Yeah. So what kind of treatment does VERO Neuropathy do to get rid of this pain? Because it sounds debilitating.
Absolutely. So we use state-of-the-art technology that's all FDA cleared to actually treat neuropathy at its source. We use electric cell signals that actually treat and help the nervous system regenerate that coating around the nerves to actually repair the nervous system's process and ability to repair. So it's a long-term solution. It's not just a quick fix. The problem's going to come right back. We want to correct this for good.
Now, everybody has seen the tons of commercials that are on TV for the pills that can relieve your pain, and that's not really the best way to treat this. But how is VERO Neuropathy different than using those pills?
Absolutely. So some of those medications you talk about, Cymbalta, gabapentin, Lyrica, maybe pain injections, or even opioid drugs, all they're doing is just masking the symptoms. They're doing nothing to correct the overall long-term condition of neuropathy. And so that's the big difference, is we focus directly on what's causing neuropathy, treat it directly out the source so people can actually live their life pain-free, not just a few hours of relief.
Now, different types of treatment involve some different things you can do that might sound like they're going to be painful, but they really aren't. They really do the trick, right?
Correct. Exactly like I said earlier, the treatment is all FDA cleared, totally safe. It's painless. We don't use any drugs, no injections. Okay, we're simply applying the treatment to the affected areas in the hands or the feet, and the electric signals actually start stimulating the nerves. And we also have another equipment that actually helps regenerate the arteries. That's combined with all of our in-office treatments, where all 8 of our doctors specialize in neurologically based care to actually get your nervous system to communicate properly. You know, most people don't even have feelings in those areas to begin with. So they might not even feel that the treatment at all on the front end, but then as they start to get their feeling back, then they can really tell how the treatment is working. You know, everything we use has been published in clinical trials, medical journals, all showing the results of long-term re-education and regeneration of the nerves.
Well, re-educating the nerves, that is an amazing statement, and that's what you are doing. And we need to find out, maybe you're experiencing this pain right now. We have a special that you need to really pay attention to. Dr. Fitzsimmons, tell everybody about your special.
Yeah, absolutely. So come into our office. What we do is we do an individualized exam. We have 8 different tests that we do to determine down to the exact percentage of sensory loss that you have in your hands or your feet, so we know exactly what's going on and exactly what we need to do about it.
Right. Now, this is a great offer for those people that are suffering from neuropathy. Take advantage. You can see the value of this $249 value. You can take advantage of this for less than $50, $49, and it's the full-blown evaluation, right?
Exactly. So once someone gets over 80% nerve damage, sometimes it can never be fully reversed. And so what we encourage people is come in, get the test done, see exactly where you're at. Okay, once you're over 20% loss, that means neuropathy is your nerves are dying faster than your body can even heal them. So it's always important to know where you're at and figure out what needs to be done. If you can take action immediately, if not, at least you have the knowledge to know where you're at and what you need to do in the future.
All right, here is the number you need to call. It's 515-335-VERO. 515 335-VERO. That's 8376. So 335-8376. 335-VERO is the number to call. Take advantage of the special and get rid of your pain. You don't have to live with it. Right, Dr. J?
That's right. There's no reason to keep living in pain. We've had people that have been suffering with neuropathy for over 30 years that are completely pain-free. You know, if you're listening or you're watching right now, you could be one of them.
All right. Dr. Josiah Fitzsimmons from VERO Neuropathy, thank you so much for your time, and we will talk to you next time.
Sounds great.